There's a book I'm currently enjoying called Designed to Grow: How Coca-Cola Learned to Combine Scale and Agility. In a chapter called Designing for the Why, the authors reference Simon Sinek's The Golden Circle model, in which he says great leaders, companies or individuals think, act and communicate and inspire action by starting with the why. They focus on purpose first, why they do what they do, not how they do it or what they make. Simon Sinek emphasizes that people don't buy what you do, they buy why you do it. Design to Grow tells us that most companies focus on what they design. However, companies that get the full value out of design start with the why they design and then shape how they design, their process, around their purpose. If there's one thing my next guest showed me is that compassion and commitment fuel the journey. And in the end, it's the unwavering dedication that paves the way to victory. This is my entrepreneurship journey, a show about entrepreneurs, innovators, and thought leaders. I'm Vula Mobile, and welcome. Dr. William Mapham is a South African entrepreneur and the founder of Vula Mobile, a mobile health platform that connects rural healthcare workers with medical specialists. Dr. Mapham is a medical doctor with a passion for using technology to improve access to healthcare in underserved areas. After completing his medical degree at the University of Cape Town, Dr. Mapham worked as a medical doctor in several rural areas in South Africa. He witnessed firsthand the challenges faced by healthcare workers in these areas who often lacked access to the resources and support they needed to provide quality care to their patients. This experience inspired him to create Vula Mobile, which launched in 2014. Vula Mobile is a simple but powerful app that allows healthcare workers to refer patients to medical specialists for diagnosis and treatment. The app includes a directory of medical specialists as well as a messaging platform that enables healthcare workers to communicate directly with the specialists. This can help to ensure that patients receive timely and appropriate care, even in remote or underserved areas. Under Dr. Mapham's leadership, Vula Mobile has won numerous awards and accolades, including the African Entrepreneurship Award and the Seed Stars World Global Winner Award. The platform has been used by thousands of healthcare workers and has made a significant impact on the delivery of healthcare services in South Africa and beyond. Dr. Mapham is a passionate advocate for healthcare innovation and social entrepreneurship. He has spoken at numerous conferences and events, sharing his vision for a more accessible and equitable healthcare system. He continues to lead Vula Mobile as CEO, working to expand the platform's reach and impact in the years to come. Dr. Mapham, thank you. Thank you very much for coming to the podcast. It's been a long time coming. I know you've been very busy, but you found time to come and be with us today. I really appreciate it. Thank you.
Yeah, and thank you for setting this up. It's taken a while, but very excited to have the opportunity to talk with you.
Yeah, I would like us to talk about your digital platform, Vula Health. What is Vula Health? Is it Vula Mobile or Vula Health?
So it's called Vula. Vula comes from Vula Mobile, which is the eye clinic where I was working in Swaziland in 2010. And that's where we first had the idea for a system that would connect primary healthcare workers with specialists. So Vula was built to do exactly that. because we saw that many patients in Swaziland had traveled, 4 or 5 hours to get to the eye clinic. And often if we'd just been able to give advice to the primary healthcare worker, they wouldn't have had to travel. And then in some cases, the patients had come way too late for us to treat. And again, if we'd just been able to give advice early, the patient would have kept their vision. So yeah, Vula was born from the idea in an eye clinic, literally.
Mm-hmm. And so then years back also, when you were in these rural areas in Swaziland, you were also practicing as an ophthalmologist in the rural areas of Eastern Cape. Am I right?
Yeah, so I started off as my dad's family is from the Eastern Cape. So
Mm-hmm.
after I finished medical school, all my electives and my community service were in the Eastern Cape. I'm very passionate about improving healthcare in rural areas. But after spending 10 months in Swaziland in 2010, I went back to the Eastern Cape and we started the eye clinic in Uitenhage. We ran that for 2 years before I got a specialist training post at Tygerberg Hospital in Cape Town. So yeah, it took me sort of 3 years to get into a training post.
Mm-hmm. So you could say your experiences in these places, especially in Swaziland, what you saw there, those experiences culminated to you now founding Vula as a digital
Yes,
platform.
that's correct. So it's not like I sort of had an idea and then sort of tried to implement it. It was just that we needed to do what was needed, and we had to find a way to connect rural healthcare workers with specialists. And it was when I was doing outreach. They call them rural health motivators in Swaziland, and she had a way better phone than me. And I realized then that, like, why aren't we using phones? Everyone's got them now. Wasn't the case, 10 years before. Um, so it was a case of doing what was needed with what everyone had. So Vula was what's still called Vula Mobile because we started off just using mobile phones.
Yeah.
Now it's on the web as well, but initially it was just phones.
Yeah. Uh-huh. So now when it hit you to say, okay, we have to do what we have to do to solve this pain point or this problem that we see. This is okay. We are going to go ahead with this. You are convinced that this is a way to go. What would your next process be afterwards?
Yeah, so I was so excited because I thought I'd had such a brilliant idea that surely everyone would want it. But building technology is expensive. Behavior change in healthcare is hard. So although I'd drawn up all my ideas, I essentially had a PowerPoint together, and I tried to sell that PowerPoint for 3 years, and no one really kind of got what I was trying to do, and I couldn't get any money. I couldn't get any developers. So there's a lot of knocking on doors for 3 years. And then eventually, you just keep phoning. And then I managed to get hold of a friend who worked at the Shuttleworth Foundation, Mark Shuttleworth, the guy who went into space.
Yeah.
And he was able to give me a flash grant, which was about 50,000 Rand. But the real bonus was the fact that I could now say that I was linked to the Shuttleworth Foundation, and that name started to open doors way faster than just my PowerPoint. And then I also, kept phoning around, and I managed to uh, get hold of Gary Marsden, who at the time ran the ICT for Development division at UCT. I'd never met him, but he said, "Stop phoning around." He said, "Like, you're gonna drive yourself mad." And he gave me three names. He said, "Just phone these three people. I think they will help." And one of them was at a user experience company called Flow, and they agreed to sort of fund the first demo version of Vula. And the other one was a software developer who, rather than kind of laughing at me with my 60,000 Rand, took me seriously. And they took my designs and they said, look, we can't build this for you because you don't have the money, but we'll cost out what you will need. And so they did all the work and they costed it out, and they said, look, you're going to need about 400,000 Rand to actually build what you think you want. And then now I had a demo, I had kind of an idea of how much it would cost. And then I joined forces with it's called the Brian Holden Vision Institute, and applied with them to the SAB Foundation's Social Innovation Competition in 2013. And we very fortunately won that one, which was R1 million. And all of a sudden, I now had the designers, the developers ready, and we had the money to build things. And then we built it and launched it in about July 2014. And again, I was so excited. I thought, wow, we've built this thing. Everyone's going to use it. And no one did. So it was a case of like, why?
Yeah.
And I was like, what's the problem? And then I realized there were some problems with the design. I got some medical students to play with it and test it. And I started to realize that I'd created kind of roadblocks in the system myself, and they could find ways around them. And so totally recommend getting users to actually test whatever you've built. And so we kind of rejigged it quite a bit. And then my prof at Stellenbosch University was very forward thinking, and he said, why don't you try it in our clinic? Because you're working in the clinic, you will use it. Other people you know will use it. You can get better feedback. And so that process started in October 2014. So the first real patients, from the initial idea in 2010 to the first real patients was about 4 years.
So now when there's medical students, when now they started using and testing it, and they came with this feedback, and then you could see some roadblocks here and there and bottlenecks here and there. So you actually had to release it and let it be used to be able to see and to be able to improve on it. That is brilliant, because sometimes we do something, we tell ourselves this is perfect, it has to go there, and when it doesn't get used, or when it doesn't get the traction we had hoped it will, we sort of like get discouraged. But you took that and reworked on it, and that is something.
Yeah, and it's a process that we continue all the time. I think one of our biggest costs is user experience, testing and design. And you're always learning, because then you release a new feature that the users wanted and needed to use, and then they tell you actually they need an extra bit here. So you continually trying to find a balance between what the users need, and then the funding you need to build those things. So that's kind of it's a constant process. And if that's just the front end, if you look at kind of the ecosystem, when we first started Vula, it was actually on BlackBerry, so a long time ago. And then obviously BlackBerry, I don't think it even exists anymore. So in 2014, we shifted to Android and Apple. And then about 3 years ago, we saw the kind of the beginnings of the rise of Huawei. And so 3 years ago, we started developing on a platform that can work on any phone, not just Apple, Android, or Huawei. And we launched that beginning of last year. So that does make things a lot easier. But the ecosystem keeps changing, so it's nothing to do with the users. is this to do with what's happening in the tech world? So it's never boring. It's always interesting.
Yeah, yeah. So back then, you were, I presume, you were one of the first entrants in the market, in the healthcare tech market, with your platform. Um, what other uncertainties or threats did you face being the first to be in the market then?
I don't think we were I mean, I think there've been so many attempts to put tech into
Mm,
healthcare. Um, and I think the challenge is like a lot of the telemedicine solutions in the olden days. You'd have to put in like huge TV screens with video cameras. It was in a certain room, and they didn't work because you're seeing your patients in a different room. So how can you use that?
yeah,
So I think we made the most of kind of the rise of mobile phones. I think I also fortunate I just come back from the United States, and had been making applications there for healthcare on mobile phones,
yeah,
and also been to kind of a very short course at Stanford on how to change behavior with technology. Um,
yeah,
so I think a whole lot of things kind of came together that gave me kind of some insight into what was needed and what would be practical and what would work.
yeah,
But yeah, we'd definitely not be the first person to. I don't think we were the first to create tech in healthcare, and I think that the common thing that happens is that people have a good idea, like I did, and
yeah,
they have a bit of funding and they build something, but they haven't budgeted for the ongoing maintenance.
yeah,
And that's actually one of the greatest problems. So you get what's called death by pilotitis. So they run a pilot, it's all successful,
yeah,
but then there's no funding to carry it on, and so that whatever it is, the thing dies. So I think yeah, you have to be wary of that. Not that I necessarily had a plan initially,
yeah,
but we made a plan as we went along to make sure Vula continued.
yeah,
Um, and then we've also seen a lot of technology built for research projects. And the danger of that is that if you build something for a research project, you have to build that thing and then study it, and then you can make a change, which is not how technology works. Technology works like we talked about. You build something, you test it, you change. You build something, you test it, you change. So it's an ongoing iterative process,
yeah,
and so you need that flexibility.
yeah.
Um, yeah, yeah,
It's design thinking. You refine it,
yeah.
let it out, it comes back with feedback, and you refine it and up until you get that. I wonder, since its inception, did Vula ever pivot, or did you ever have to alter your business model?
Yeah, I guess so. Initially, Vula was only available for eye care referrals, and but having worked as a rural doctor, I always wanted it to do more. Um, but any sort of big change like that is expensive, and we were running out of cash. But at the end of 2015, Vula was one of the 6 winners of the African Entrepreneurship Award,
Okay.
and that was a prize in dollars. And shortly after we won the prize, our president at the time fired the finance minister, which meant that the dollar rate went through the roof. And so when we transferred it to rands, it was a whole lot more than what we had budgeted for,
Yeah.
which was fortunate for us. And that enabled us to change Vula from being available in version 1 for one specialty to version 2, which could be any specialty. So, and I think now it's available in 75 specialties. So that was a big
Ah,
pivot back in
yeah.
2016. Yeah.
Yeah. Wow.
Um, but that's in terms of the users. I think it took me a long time to work out how to make Vula sustainable and get some revenue. But yeah, that was a different process. Yeah.
Yeah. Yeah. Talking about this awards, Vula won in financing, you have experience with going through those stages of, VC financing. What are those stages? And in starting, when for someone who's just right in the beginning, how should they prepare themselves?
Yeah, I mean, like when I was back then, I didn't know. But the one thing that doctors are good at is filling in forms.
Yeah.
So I just filled in forms for any competition I could find, any health funding. Um, and so I must have done about 60 applications per year in the first few years. And as long as we got one or two, then Vula would survive. But I was also working full time as a doctor then. So all the
Yeah.
money went to the development.
Mm-hmm.
Um, and I did a course called Lab to Market, which was really interesting. It was run through three universities in Cape Town, University of Western Cape, University of Cape Town, and University of Stellenbosch.
Mm-hmm.
And during the day, they would give us these lectures, kind of answering the question that you've asked, like, what are the stages that you go through? And they would say, like, oh, you raise money from your friends, then you raise money from a angel investor, then you raise money from a seed investor, then on and on and on. And at the end of the day, they would invite actual entrepreneurs to come and present,
Mm-hmm.
and none of them had been through that exact process. Each of them had had a unique journey, and that was so interesting for me, because then it's okay to have your own journey. You don't have to follow anyone's rule book.
Yeah.
And so basically, I carried on filling in forms, and I think in the first 3 to 4 years, we managed to get about 6 million rands worth of basically funding or prize money, which
Yeah.
enabled us to have unrestricted kind of freedom to build what we wanted to build, and not be beholden to anyone. I think that was such a game changer for me. I think later on, when we took on investment or had some particular grants, they become very prescriptive of what you can do, and that's actually not what you need when you're starting a technology intervention in an area like healthcare, where there isn't sort of instant commercial contracts available. It takes time to develop traction and prove that your idea is a good one.
Yeah.
So if you can, if people are listening and they're thinking, sure, if I really want to start my idea, my advice would be to make a demo in any way that you can. Get people to use it, and you can make demos very cheaply now on your own, and then create what they call there's something called a business model canvas. It's kind of like a one
Yeah.
pager that you can fill in, and it
Uh-huh.
gives you a sense of kind of like, what's my thinking, and that's
Mm.
those two things I think are enough to get started.
Mm.
And then fill in forms. If you're in healthcare, there's a lot of money out there. Just find as many applications as you can, fill them in. Even if you get a negative reply, you'll learn something like why. What was the problem? You can adapt the next time, and don't get too emotionally attached to any one particular funding source. I remember there was one fund, and I was totally convinced that we were going to get it, and it was a large amount of money. It came with a lot of support, and I thought, this is it.
Yeah.
And then we got through to the last three, and I thought, wow, they're going to fund us all. And they decided to only fund the other two, and I was
Okay.
so upset. And then my wife said, what's your problem? Like, you filled in a form. Like, that's all
Yeah.
you did. Like, you don't have to worry about this. Fill in
Yeah.
another one. So we kept on, you just keep going. And I think
Yeah.
there's always a way to make it happen.
To try again. if you don't succeed the first time, to say give it another shot.
Exactly.
Yeah,
Exactly.
yeah,
Yeah.
yeah. You spoke of earlier. You spoke of the going to Stanford. I know you attended a Solve MIT program, and you recently got selected for Stanford a seed program. What are these programs, and what do they mean really? Is it also about filling forms? How do they benefit Vula?
Yes, they're all very different. We've never been part of an incubator. I never kind of quite saw, or maybe I just never had the time, or maybe we didn't get accepted. But the MIT program is more like a network of people who solve problems.
Okay.
And MIT is, very famous for uh, creating an environment where people can solve problems. So, like, we went to
Yeah.
visit some of their labs, and like they would say, "Cool, here's the problem. People are battling to take the leaves off a mealy very quickly, and also to take the kernels off the mealy quickly. If they could do that in half the time, they would decrease the amount of time they have to do that. They can then sell more. They can sell their grain faster, and so they set the students that challenge. Um, but they also sent them into the field, because often they would say, "Oh, I've got this really cool solution," but then it breaks, and then who fixes it? No one knows how to fix it, right? So they would take things like, "Okay, cool, let's use a bicycle chain," because everyone, you can buy a bicycle chain at a nearby store or something.
Yeah.
So it's about creating very practical solutions for real world problems.
Yeah.
And so the MIT has a lot of networking and being introduced to people. Coming from, as a doctor, coming from a rural area, I didn't know a lot of people. So suddenly you're in a room with like, people who run Google, people who run like big surgical robotic companies. And it's just incredible to get that level of exposure, and also just to learn from people who you never thought you would have met. And then also to see whether there is money available. So like, I remember going into one of their auditoriums, and the amount of equipment that they had in that room, from the video cameras, the huge screens, it was almost like a theater stage, like special lighting. So when people presented on stage, or when they spoke, it was like a TED talk. It was phenomenal. So every lecturer seemed like they were like a rock star. And but I mean, just that theater alone probably cost more than it cost to build Vula in the early days. And so you realize that often we try to make do with very little, and it's fine. I still think it's a very good idea, but we don't have to be limited in our thinking in terms of what's available in the world. And so I think MIT really opened my eyes there. There wasn't really kind of like a program. It's very different to Stanford Seed. Stanford Seed, you apply. It's a year-long course or journey, and if you are selected, you still have to pay, but you can negotiate the amount you pay. I think that's part of the process. And then there's like 110 CEOs from across Africa, but they're very particular about the stage at which they take companies. So all the companies in the program are, have a product, they have some revenue, they're trying to scale fast. And so suddenly you're in this room where everyone is working, no one's kind of taken time out. Everyone's dealing with similar kind of scaling issues. And again, they have these like rock star lecturers from Stanford who it's phenomenal to realize how people get taught and the way they teach. So you go to the sort of the in-person sessions, but they have given you what they call pre-work, and you are totally expected to have spent at least a day working on the pre-work, maybe even more sometimes. So when you start the lecture or the session, everyone already knows. There's no like summary. There's no like presentation about the material.
Yeah.
It's straight into discussions, questions, like. And I think that was it was so amazing to be exposed to that type of a learning process.
Yeah.
So yeah, I think it's a very different program to MIT, but it's been amazing so far.
Yeah, yeah. Your journey is very inspiring, Dr. Mapham. I can I can tell you that
Mm.
that young ophthalmologist working in the rurals of Swaziland now now doing this amazing work. It's very very inspiring. That it can be done. I remember when earlier you said the developer guy was laughing at you with your 50,000 when you wanted them to develop this app for you. I know I think I shared some business canvas model with you. I was like, I want to start an app that does this in the healthcare, and so I also showed it to a developer friend of mine who said, I think you're going to need about 450,000 to develop this app. I was like, really? She says, yes, this is how much you would need. And I was like, wow, this seems impossible. And I know you have a commercial partnership model where you commercialize your technology. I would like us to talk about that. Can you tell us a little bit about that?
About the technology itself, or
Do you because now you have developed this technology, and can people who maybe want to make a demo or starting maybe their platform that is more similar or could use some of your technology, can they rent your technology, can they rent your research? I don't know, do you do something like that?
that's what you mean.
Yeah.
So I mean, my belief is that healthcare can only be delivered through partnerships.
Mm,
No one owns healthcare. I mean, Bill Gates doesn't own healthcare, or at
yeah.
least not yet.
Yeah.
So yeah, you have to find partnerships.
Mm,
And so the way we work is that I've been a doctor. Like you said, I totally believe that I could build everything with 50,000 Rand,
mm,
which obviously wasn't true. And I often get people saying to me, I've got this amount of money and I'd like to build this massive app.
yeah.
My suggestion is that if they want to use Vula,
Mm,
any health worker uses Vula for free. So you can
mm,
now use Vula as sort of your app in your clinic to do the things that Vula can do.
yeah.
And so it saves a healthcare worker all the time of having to build something. They get what they want
From
and they can
scratch.
make a difference.
Yeah.
Yeah. So that's
Okay.
my one offer. The
Yeah.
other thing I say is to people is that isn't there something you can use for free to do that thing? And maybe there's a simple tool that they can use that makes a difference. Because at the end of the day, you want to make a difference in healthcare.
Yeah.
Uh, Not every doctor wants to give up their job and run a tech company.
Yeah.
So yeah, it's a choice that people have to make.
Yeah.
And the other thing is that people do want to build their own system, just to be aware that it's an industry that is not talked about at medical school,
Mm,
and it's way more expensive than I'd ever imagined. And so often when you talk about the financial aspects of Rula, people are quite surprised.
yeah.
Um, but yeah, it's also, I think it's got to the stage now where I think it's great that people are experimenting and trying to improve the system.
Yeah.
Um, so I think that I'm always encouraging people to have a go,
Yeah.
but definitely find a cheap way or a free way to make a demo, get people to use it, watch them, do as
Mm,
much as you can without spending any money,
yeah.
and don't give up your day job until you really think that you're gonna make a living, or you are making a
Yeah.
living. So yeah, I
Yeah.
think that was a tough lesson for me.
So, Dr. Mapham, I know Vula recently partnered with a big pharmaceuticals like Novartis and Sanofi. I would like us to talk about that. Can you take us through that?
Yeah, so I think healthcare can only be delivered through partnerships,
Yeah.
and some of
Yeah.
the big partners in healthcare are pharma companies.
Mm.
So they do have a mixed reputation, but essentially there wouldn't be modern medicine without pharmaceutical companies.
Mm-hmm.
So if you went to a hospital and there were no medications, there would be not very much point in going to that hospital. And many of the pharma companies know that in order to make sure that patients get the medication they need, you also need to improve the health system. So, for example, with Novartis, we've got contracts for them with ophthalmology,
Mm-hmm.
um, and as well as sickle cell disease.
Mm-hmm.
And so that's been an amazing one so far.
Mm-hmm.
And then with Sanofi in South Africa, we didn't have psychiatry or endocrinology on Vula.
Okay.
They paid for, we won Africa Tech, which was their prize in Paris in 2018.
Yeah.
And that led to a contract with them. We then launched with psychiatry and endocrinology in South Africa. And more recently, we've managed to get a contract with them to improve referral systems around non-communicable diseases, which is things like diabetes and hypertension,
Uh-huh.
and that's in Zambia.
Okay. And so currently the Vula platform, it's available in which countries? I know South Africa. You spoke of
Yeah, so it's currently
yeah.
used in South Africa, Lesotho.
Mm-hmm.
There's been a pilot in Botswana,
Mm-hmm.
um, then Ghana and Ethiopia.
Wow.
We're always looking
Okay.
for partnerships to roll out in more places.
Yeah. Yeah. You know, Dr. Mapham, I was going to ask you about a book that has made an impact in your journey with Vula, but I know you are passionate about the DRK Foundation. Can we talk a little bit about the DRK Foundation? What do they stand for, and what do they mean to you?
Yeah, so the DRK Foundation was probably the best. I mean, I joke about filling in forms, but
Yeah.
it was truly life changing being accepted into their program. Um, they invest broadly in entrepreneurs that make a difference. It's a very broad kind of mandate. It's not sector specific. It's everything from healthcare, access to female products, prison reform in the United States, education in India. It's really a very huge kind of network of incredible people.
Yeah.
And the two main things they give, as one is funding. So they give you unrestricted, you spend it in the way that is needed to be spent,
Mm-hmm.
funding. And that was 300,000 US dollars at the time. So it's a huge amount of money for us at that time. And then they also gave me a board member who basically worked very closely with me, Dr. Bill Rodriguez, who was used to work in the United States. He was one of the first doctors to treat people for HIV. He worked around many countries of the world implementing health programs. He
Yes.
had launched health tech startups in Africa and sold them. And so I couldn't have had a better mentor, advisor than him. And when they first came on board, I was the only employee. I didn't have any commercial contracts. I guess they saw me as an entrepreneur making a difference, but
Mm-hmm.
the other criteria they have is that the entrepreneur must have the potential to affect 1 million lives within 3 years.
Mm-hmm.
And when they joined, I just thought, yeah, that's maybe one day, but it's just really far off.
Yeah.
Um, But with Bill's involvement, we went from 1 employee to 13. We had commercial contracts, and then last year we had our millionth referral. So on
Wow.
Vula. So it was, I totally credit them for really fast tracking my impact
Yeah.
beyond my wildest dreams, really.
Yeah.
So if you can get into their program, I can't recommend it highly enough. It was life changing.
Yeah. Wow. William, thank you. Thank you very much. This has been inspiring, eye-opening. You're doing incredible work, and thank you for availing your time to be with us today.
Yeah, thank you so much. And I think that one question that you sent me in advance was, do I have a book that I like that helped me? And
Yes. Yes.
it's quite funny because my mother was a librarian, so we grew up
Okay.
with a lot of books. And
Yeah.
although my father was a computer scientist, he wasn't a fan of TV. So I've actually never owned a TV.
Wow.
So what I would recommend
Yeah.
is, if you want, people say, oh, I don't have time to do a business, or I don't have time to do my thing. But if you just look at the time you spend watching TV and then spend that on your startup or your idea, you actually have a lot of time. And then in terms of books, I would say there are many I've read along the way. I think it's definitely a journey, and I think it's not a business book, but I would recommend a book called The Hero with 1,000 Faces,
The Hero with 1,000 Faces.
which is actually about stories and the stories we tell each other. And it's really useful because it shows how different stories are told in different ways across all different cultures, but there are common threads. And when you're telling the story of your startup and how you need to get funding, you are selling a story, not just an idea. And I would really recommend that people learn about how to tell stories. I think that's it's not a business thing, but I think it's actually super helpful. So I would recommend that one. Yeah.
Yeah. The Hero with 1,000 Faces.
That's the one. Yeah.
Wow. William, thank you. Thank you very much.
Yeah, thank you so much. It was an honor being on your show.
Thanks for listening to our show this week. If you enjoy our show and would like to support us, help us by spreading the word. Tell your friends about Merge and engage on social media. Follow us on Twitter, Instagram, and Facebook. Our handle is @Merge Podcast. Merge My Entrepreneurship Journey on LinkedIn. If you would like to engage with us privately, drop us an email at defoe@mergepodcast.com. Remember, we are available and streaming wherever you get your podcasts. I'm Vula Mobile, and you've been listening to My Entrepreneurship Journey. Hey, Merge Podcast community. I would like to take this moment to express my sincere gratitude for your support and engagement with our podcast. If you enjoy our show and find value in the insights shared here, I kindly invite you to click the follow or subscribe button on your podcast platform. By doing so, you will ensure that you never miss an episode and stay updated with our latest content. Following or subscribing to our podcast is a simple yet meaningful way to stay connected and be part of our growing community. Your support and engagement are crucial in shaping the future of this podcast. So, by clicking that follow button, you not only demonstrate your enthusiasm for the content we create here, but you also contribute to our mission of fostering insightful conversations and personal growth. So if you are ready to join us on this journey, please take a moment to click that follow or subscribe button. We genuinely appreciate your support. Thank you for being part of our community. And remember, stay curious, stay inspired, and let's keep exploring together.